Good morning. Today we're going to talk about the coronavirus disease and what it is and what we can do to protect ourselves. This is an important issue for us to address. It's a health issue which can affect us as far as our occupational safety and health. Occupational Safety and Health Administration has already issued a statement in relation to the coronavirus. So this is something that we ought to address ourselves. First of all, what is COVID-19 and how can we protect ourselves? It's a new virus. It's called the Severe Acute Respiratory Syndrome Coronavirus 2. It's been identified as the cause of a disease outbreak that began in China. This disease is called coronavirus disease 2019 or COVID-19. You may see it written that way. It's a type of coronavirus. It's a family of that which is a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome, and Middle East respiratory syndrome, all of which we have heard about in the news over a period of time. Because this virus is so new, there's not a great deal that's known about it as yet. Public health groups such as the World Health Organization and the U.S. Centers for Disease Control and Prevention, the CDC, are investigating, so you may check their websites for updates. The new coronavirus appears to be spreading from person to person. It may spread by respiratory droplets when someone's infected with the virus, coughs or sneezes. It's unclear exactly how contagious the virus is. We understand that it is, at this point, causing issues up to and including fatalities in China, and there has been at least one instance of a fatality here in the United States with an individual who had several other health issues at the same time. So COVID-19 symptoms can be mild to severe. They can include a fever, a cough, shortness of breath. Symptoms may appear 2 to 14 days after exposure. A coronavirus vaccine is not currently available. The World Health Organization and the Center for Disease Control recommend that you take the usual precautions for avoiding respiratory viruses. These include, and this is something that you can actively, practically do to help yourself, wash your hands often with soap and water or use an alcohol-based sanitizer. What I have seen in other writings that I've read is that the alcohol content within the hand sanitizers needs to be higher than 60% in order for it to be genuinely effective. Cover your mouth and your nose with your elbow or a tissue when you cough or sneeze, then throw away the tissue. Avoid touching your eyes, your nose, and your mouth if your hands are not clean. Avoid close contact with anyone who is sick. Clean surfaces that you often touch. And if you are ill, stay home from work and from school and from public areas as well. The CDC does not recommend that healthy people wear face masks to protect themselves from the respiratory illnesses, including COVID-19. Only wear a mask if a healthcare provider recommends that you do so. In addition to those, the World Health Organization also has recommended that you avoid eating raw or undercooked meat or any kind of animal organs. And if you're visiting live markets in areas that have recently had new coronavirus cases, avoid contact with the live animals and the surfaces that they have touched. If you're planning to travel internationally, first check the CDC and the World Health Organization websites for updates and advice, and also look for any travel advisories that may be in place when you plan to travel. I just wanted to take this opportunity to pass this information on to you, especially on job sites as you're out there. It may be worth your time to purchase some hand sanitizer so you can carry it with you, so you can have it handy, especially using the public toilets and that sort of thing that are there on the job sites. So I trust that this is useful to you and that you will find yourself being able to be successfully guarded against this coronavirus. Thanks very much.